care at affordable prices. If you're thinking surgery, think Medfin. And a very warm welcome to our today's session. As you all know, with us today is Dr. Sreedhara V Setty, who is an expert surgical gastroenterologist. Dr. Sreedhara has been a meritorious student along through his medical career, has completed MBBS from reputed Mysore University, specialized in advanced laparoscopic gastrointestinal surgical procedures, including cancer surgery and others. Dr. Sreedhara's focus is abdominal surgeries, both laparoscopic and open, including esophagus, stomach, small bowel, colon, liver, pancreas, gallbladder, and bile ducts. Without further ado, I would like to start off our today's session. Doctor, welcome to the session. And first question is, what is gallbladder and why is it important in the body?
Yeah, thank you very much for a nice introduction. Gallbladder is a storage organ for the bile. So in between our having meals, the bile gets stored in the gallbladder, and once we have our breakfast, lunch or dinner, the gallbladder gets squeezed and all the bile enters the intestine, and it's usually required for digestion of the fat contained in the food.
Okay.
So this is the main organ, and each time it squeezes, more than 80% of its contents gets emptied. So that's, we call it as the normal functioning of the gallbladder.
Okay.
Yeah.
And what are gallbladder stones? We often hear this, gallbladder stones. So what are these stones and how are they formed?
Yeah, these are the concretions of the bile itself. When I say more than 80% gets squeezed out, in certain people, the squeezing, or we got what we call it as the ejection of the bile, is incomplete. When it is less than that, a significant amount of bile gets stayed back in the gallbladder. And for each time, the remaining gallbladder becomes thicker and thicker, and they start forming concretions. And on these concretions, there will be a little deposition of calcium or fat or blood, and these form the stones.
Okay.
This is how the calcium, the gallbladder stones are formed.
Okay, so it's a mixture of the gall enzyme itself and the calcium which gets deposited on it.
Calcium, and also a little bit of bleeding, and sometimes even the infection also will cause this deposition on the stones.
Okay. What are the signs or symptoms of gallbladder stones?
Yeah, so patients will have what we call it as a biliary colic. So most of the times the patients will complain whenever at some meal, they'll have a sudden pain in the upper abdomen or in the lower chest, and it usually goes off on its own after some time, maybe about 30 minutes to 2 hours. Or sometimes these same patients will take some antacids or omaze or something like that, and they relate to that one, saying that after taking the tablet that goes off. But eventually that pain will not reduce with the omeprazole or any of the Rantac or the antacids. That's when they start going to a physician to check out what else has happened.
Right.
So the pain is similar to what they get in acidity. They can have a little burning in the abdomen or a little bit of regurgitation, or they might have a little bit of vomiting sensation, or some patients will have a pain in the back. So they can have a little excessive of belching or abdominal bloating. All those things will be there. Okay. So that's when we start doubting these patients can possibly have gallbladder stones, and we'll start investigating them.
Mm-hmm. So you said when the bile duct, when it produces enzyme, when it does not produce fully is when these gallbladder stones occur. But externally, what could be the factors or causes for these stones to happen?
So other than this bile which becomes thickened and forming the stones, the patient factors, they've seen it's more common in more than 40 years and more common in females and patients who are a little bit of fat over there. And these are the people they have found out they have increased chances of developing the gallbladder stones. But in this age where the patient's threshold is very low and they do go to a doctor with a slightest problem, we have found out stones in as young as 5 years and 8 years old. or sometimes they do come to us when they are 60 or 70 years also.
Okay.
So that's how varied the presentation with respect to the ages. And we have also seen the same stones present even in thin patients. So more so in the obese patients, but it doesn't rule out the formation even in who are little slim and thin also.
Okay. Why does the bile become thick? Is it a lifestyle thing or is it genetic? Is there a possibility of like parents passing on to children, something like that?
Yeah, we have found out some patients where the stones are hereditary, but we don't have anything to say there is a genetic contribution to these things and it's seen hereditary. Only thing is we just happens to be there for the parents as also to the kids. So the other things, what we can tell you is these patients have to be a little bit more sensitive and then come to us the moment they have a little bit pain which is not settling down with regular medications.
Yeah. So that is why the bile is thick. Like one is.
No. The bile, it doesn't eject properly. It's like a balloon which is collapsed after meals. In between the meals, the balloon like gallbladder gets filled up with the bile. So when it has to squeeze out completely, more than 80% has to get squeezed out. When the squeezing out is incomplete, the bile stays back. The water content in the bile will get absorbed. So the bile becomes a little more thicker and oily. And this over weeks and months starts becoming more and more thicker. And a few sand-like particles will develop. And on that, there will be deposition and they start forming more and more stones.
Okay.
And these patients will start getting the pain when it goes and gets impacted in the neck of the gallbladder.
Okay.
So as long as it stays in the gallbladder, it doesn't disturb anybody. But even it gets squeezed a little bit, and one of these stones will go and block the outflow of the remaining bile. That's when the patients will start having that biliary colic or a cramp-like pain. And once that stone gets dislodged back, they'll have an immediate relief and they just continue to do their routine work.
Okay. So what are the treatment options for gallstones?
If they are asymptomatic, like a patient on a regular checkup after 40 years, or because a company wants it, or on their own when they do it an annual checkup, if they find out any stone, then those patients need not undergo surgery. But however, patients who have developed, who have come to us with the pain, with an upper abdomen or a little vomiting sensation or a little jaundice and a little back pain, all these people, when we investigate, these are the early symptoms of the gallstone disease, and these patients definitely need treatment. Initially, they have tried all other kind of treatments like tablets or putting in a catheter into the gallbladder and trying to dissolve the stones, blasting of the stones. But none of this have worked. So laparoscopic cholecystectomy is the gold standard across the world for gallbladder stones. So which means surgery is the only treatment which can help these patients.
Okay. Are there different kinds of gallstones, and does the treatment differ from type to type?
Yeah, there are different kinds of stones. If there are more of fat, they are called the cholesterol stones. If there are more of found because of blood deposition on these stones, they are called the pigment stones. Sometimes we get a mix of both cholesterol and also pigment stones. We call it the mixed stones.
Okay.
However, the treatment for any of them is still the gallbladder surgery only.
Okay.
And there is no medical management for any of these patients.
Okay. And sometimes people tend to ignore these pains, like when there is stomach pain or all of these symptoms people tend to ignore. What happens if gallstones are ignored?
When the stones are ignored and even when the pain, they just take some rest and then continue to do the work. Over time, if the stone gets impacted in the neck or the duct of the gallbladder, if it gets impacted and doesn't move, whatever the bile is remaining in the gallbladder can get infected. We call it as an acute cholecystitis.
Okay.
So this cholecystitis can worsen, forming a gangrene of the gallbladder, which means decaying of the gallbladder itself, or it can perforate. It can burst through the gallbladder and spread it into the entire abdomen, causing a serious condition which needs emergency surgery. Or it can erode. It can go through the liver itself and form a pus formation there also. So these patients do come to us in a very critical condition, and we'll have to do the surgery under very high risk.
Okay.
In case the stone gets dislodged, enters the common bile duct, the tubing which enters into the intestines for digestion, these people can have jaundice. There's a blocking of the bile. The bile which is produced from the liver goes back into the bloodstream and causes jaundice. In case stone goes a little bit lower down and gets impacted there, the pancreas can get infected. So this jaundice and the pancreas getting infected, which is called the pancreatitis, is a much more serious condition which will need an ICU care and a possible delay of the surgery in view of a poor condition of the patient. So we don't want patients coming to us in such a state where we give very poor prognosis to them.
Right. And that's pretty scary to hear what all this could lead to.
That's pretty scary, and it's a kind of life and death situation for the patient.
Okay. So now talking about the surgery, laparoscopic cholecystectomy, how long does the surgery take, doctor?
On average, patients, when they come a little bit early, we do it in as early as maybe 20 minutes, 30 minutes also.
Okay.
But people who come with an infection, sometimes the surrounding organs like the intestine, stomach, or the large intestine would have got adherent. We need to be more careful in separating them from the gallbladder and then do it. So in those conditions, you may take a little bit more than 1 hour also.
Okay.
So anywhere between half an hour to 1 hour is the usual time for these kind of surgical procedures.
And is there a stage? Can these be divided into stages? And like the complications depending on the stage, how long would it take for each treatment? And also,
some patients do come to us within the moment they had pain for the first or the second time. We have also had patients who tried the other kind of treatment like Ayurvedic or homeopathy and all those things. And once they realize those things are not helping them, then they come to us after about 6 months or 1 year. Sometimes the very first time patients gets a complication can be a gangrene gallbladder. Or the very first time they can come with a jaundice. Or the very first time they can come with a pancreatitis. So these are a few unlucky patients who have not been having pain, and they've been very good to taking care of their health, but suddenly present with a severe condition. By and large, most of the patients do come to us with a little abdominal pain, what we call as a biliary colic.
Okay. So when we are talking about the pre-surgical procedures, what are the steps taken before pre-surgery?
Patients who come with mild symptoms like an abdominal pain or a biliary colic or a little vomiting. So these patients are evaluated in the outpatient basis. Okay. For the gallbladder surgery, few investigations are there, like a liver function test. We do it, and the liver also forms a few of the clotting factors, so we check on that one. And there are investigations which we do for the anesthesia purpose, like the hemoglobin or blood sugar or kidney function test, ECG or an echo. Or and also if these patients have other medical problems like diabetes, hypertension, asthma, the investigations to check how well managed they are with these conditions, we check on them. And then we'll go ahead with the surgery. Of course, for the confirmation, we will always do an ultrasound abdomen just to check on the condition of the gallbladder.
Okay, okay. And how long does a patient need to stay in the hospital? We also have one of our audience asking the same question. Mr. Adi Kapoor asks, is this a daycare procedure, or do I need to stay?
This is a daycare procedure. We admit about 2 to 3 hours before the surgery. So we ask them to start from home early morning around 6 o'clock with a glass of water. They come to us around 7 o'clock. We'll take about 2 hours to get the investigations, get them ready. This surgery is usually done as a first case at 9 o'clock. On the same day, after about 3 hours after surgery, patient is started on liquid diet, and by evening they take soft diet, and we discharge them if the patient is willing on the same day. Or because of the insurance purpose, if it's mandatory for the patients to stay for at least 24 hours, 99% of my patients do get discharged the very next day.
And after the surgery, post-surgical care, what are some of the necessities, or what should people take care after the surgery?
Nothing much. We will ask them to take their regular diet. So we just tell them to avoid oily food for about a week or 10 days. Otherwise, we always encourage them to go about their routine work. Most of our patients get back to work in 3 to 4 days itself. We tell them not to drive or lift any heavy things for about 15 days. And then once they're pain-free and they're doing their regular work, they can get back to driving a vehicle or lifting a weight or carrying some luggage like a laptop or something. So definitely after about 15 days, they'll be like normal as before.
Okay. So when you spoke about diet, that reminds me of a question about the consumption of alcohol. How is it related to...
Before or after surgery, this is not related to alcohol at all.
Okay.
To put it on a little bit lighter vein, we get the spouses who come and tell us to tell the patient, advise them not to take alcohol. So we do take this excuse to tell the patient not to consume alcohol. Otherwise, now that the gallbladder is gone, the next thing the liver will get damaged. So unless they want the liver damaged, I think they should stop the alcohol. So for about till everything settles down, they'll be on few medications, they'll be on some diet restrictions. So we tell them to avoid alcohol. After that, honestly speaking, there is no relation between alcohol and gallbladder stone or the surgery.
Okay. And yeah, like you mentioned, the recovery time is pretty fast, 3 to 4 days and things. When we're talking about the advantages of laparoscopic cholecystectomy versus open surgery, what advantages and how does the treatment differ?
Okay, so there are the patient-related thing. One is a large incision is made about almost 6 to 7 inches in the abdomen. And the surgery, what can happen for half an hour will take 1.5 hours, because I'll take 20 minutes to cut open the abdomen and another 20 minutes to stitch the abdomen back. And then there is wound-related sequelae like increased pain, sometimes a wound getting infected. And the next thing is the delayed sequelae is patients will not be able to lift any weight for about 3 to 4 months till the incision is completely healed. Whereas in laparoscopy, the opening of the entering into the abdomen and getting out hardly takes about 2 to 5 minutes. That is one thing. Compared to an open surgery, the pain relief is much, much better. On a scale of 1 to 10, if 10 is for the open surgery, for laparoscopy, it is only about 2 to 3.
Okay.
And with each passing day, it starts exponentially reducing down. Okay. So usually the 50% of the previous day. So when I say about 3 to 4 days, they're 99% of the time they're pain-free. And the next thing is the scar. So after about 15 days, it will be very difficult for anyone to find out if these people have undergone any surgery. In an open surgery, that scar is there for a lifetime to narrate a story actually. And they can get back to work, and especially in this fast age where their job or the earnings are very important, they can get back to that routine as early as possible.
Perfect. In all terms, laparoscopy seems much convenient, easier, and also financially viable option.
In an open surgery, it's usually the surgeon and an assistant who will be able to see what we have been doing. Right. However, in laparoscopy, because it's a kind of a live surgery, even an anesthetist or a nurse, everybody will be watching. So we can be assured those people are also keeping an eye on how well we have been doing. Sometimes even we do take their support or a suggestion in case of an on-table procedure, a difficulty as how to do those things or what step to take. And the nurses are also ready to immediately respond of what additional things are required. And recording is also available for laparoscopy, and in open surgery, it's not available. So in case of requirement in a later date, we can always go back and check if everything was done proper and all those things. Yes.
We have some questions from the audience. Before that, I would like to say, if you would like to book an appointment with Dr. Sreedhara Setty, please call us on 7026 200 200. And I know all of you are worried about coming to our hospital or out during these times. However, at Medfin, we have launched Safe Zone Consultation to help you consult the doctor. We also offer video consultations as well as consultations at our Medfin clinics, and all necessary precautions have been taken so that your experience and healing is risk-free. And the protocols that we follow before surgery is fever screening before you enter the hospital, history of past illness, smell test, chest x-ray for the patients and the attenders, travel history, location check, people from red zones are not allowed. And also we check with Arogya Setu app, only one attender per person per patient is allowed. So we have taken all necessary measures to make your experience risk-free. And now going to questions from our audience, we have a Srimani Alam who's asking that my mom has a 1 centimeter gallbladder stone without any symptoms, and we found it was we found it while we were doing some checkups for other reasons. Does this require surgery? And can laparoscopy be done, or can it be melted using some medicines? How long can we wait for the surgery, as we need to wait for COVID to pass?
Okay, if it's one of your viewers' mother, I would expect so if it's one of your viewers' mother, I would expect her to be more than 55 or 60 years. And this is done on a routine checkup or annual health checkup. And though the size of the stone is 1 centimeter, we would not suggest any surgery for this patient. Till she complains of little pain or vomiting or any fever with the shoulder pain. However, the stone surgery, the laparoscopic surgery for a stone disease is not related in any way with the size of the stone. Right. So we have had patients who come to us with a 2 millimeter stone or a 1 millimeter stone also, but giving in life-threatening condition in these patients. So the size of the stone, the type of the stone, the number of the stones do not matter also. So the largest stone I have removed has been for a 5 centimeter stone. But the smallest stone I have done surgeries for a 1 or 2 millimeter stone also. So I have done surgeries for a single stone of 2 millimeters, and I have done surgery for a packed gallbladder containing more than 100 stone also. So it doesn't matter how many or what kind or the size of it. All these patients need only one procedure, which is laparoscopic cholecystectomy.
Okay. Dr. Lakshmi is asking, once the gallbladder is removed, how does the bile move from liver to the intestine?
If you can show the picture what was done before, it's an outpouching of the bile duct which forms the gallbladder. So what we do is, like this is the outpouching from the gallbladder. What we do is we cut it here. We cut it the outpouching just where it gets into the bile duct. So the bile which is produced from the liver will enter the bile duct and also intestine continuously. It will be staying in the intestines, and once the food starts entering, they are there to digest it. It's like in this lockdown period, the police are already on the road. The moment a stone, I would say all those people who don't take the lockdown seriously, enter into the road, they're there to push them back. Right. So that's kind of job. The bile is there already, always in the intestine. So the functioning of the liver will not change. The food habits of the patient need not change. we do get an inquiry saying that post-surgery, some patients do put on weight. It doesn't relate with any because of the surgery, but only thing is these patients would be having some abdominal pain before surgery. So those people will be hesitant to eat food because they know the moment they eat something or they eat a little bit more or they eat a fatty meal, they would get this pain. So they would be eating less before surgery. So once this stone is removed and the surgery is done, they are pain free, they're comfortable. So they start eating comfortably well. So that's when they put on weight. So we do tell them to have a watch on their weight, not to overeat just because they're pain free. So being fit is the in thing now. So we should not allow any of them to become obese.
Okay. So I have another question from Neha, who's asking, is there no way to remove the gallstones without removing the gallbladder?
I would be happy to remove only the stones. I can do it. Only thing is the function of the gallbladder is affected. And if I remove only the stones, in 6 months' time, it will form few more stones. And I can definitely get my surgical fees each time I keep removing. So the treatment for, as a cure for this thing is removing the factory which forms the stone, which is the gallbladder. So it's a one-time procedure, and for lifetime, they wouldn't get the gallbladder disease related to stones again.
Right. So we have a last few minutes left. So quickly, if you could like tell us what kind of food intake is good to maintain general health for the gallbladder, somebody who's probably in the early stage or somebody who is trying to prevent it from growing further. What kind of food diet would you suggest?
Okay, it has to be a little fat depleted food, less of fat, more of vegetables, fibers and proteins and fruits, that kind of meals. They need to maintain their weight, be physically active. In spite of this, if they do get stones, it's their bad luck. They need to see a doctor the earliest.
Okay. And how serious is the gallbladder surgery? Like once the gallbladder is removed, like you said, there are no issues. But how serious is the surgery?
Gallbladder surgery, it's done as a daycare surgery. So which means it's not serious at all. In a well-trained and surgically skilled surgeon, if the procedure is done in 20 to 30 minutes and the patient starts having the meals in 3 to 4 hours, they can go back home. So we have not had any mortality, the deaths or complications in the last 5 years of my training of doing the surgeries in the last 5 years. So rest assured, they can just walk in with their gallstone problem and they will walk back and start doing the work from the very next day.
Right. I have one last question before we end our session today. I have a question from Mahipal who says, my niece is pregnant and has 2 stones. She's on medication, but complains of frequent pain. What to do?
Yeah, pregnancy is one situation. We try to be a little, what we say, evaluate the entire pregnancy and also the gallstone disease. So patients who are having little biliary colics and pregnant, the first 3 months we avoid doing it. The surgery can be done anytime. The first 3 months we don't want, because of the medicines we give or the anesthesia we give, we don't want any birth defects for the child. The best time for operation on these patients is in the second trimester, between 4th and 6th month. So that's the best time where even the pregnancy is not affected, even the child is not affected. We can comfortably do the procedure as a daycare procedure itself. So in the 3rd trimester when they come, so that is when we need to be more careful because they got a full abdomen because of the pregnancy. The surgical technique becomes more challenging. So if they're very close to the date of delivery, what we do is, on the day of their delivery, either a cesarean section or a normal delivery, so we go ahead in the same hospitalization and do the gallbladder surgery. So advantage is both the situations are dealt with in the same hospitalization, and patient need not come back and get readmitted, and they can continue with the lactation and the other things later.
Fantastic. Thank you, doctor. Thank you so much.
Thank you.
There was so much information we got in 30 minutes. Thank you so much for joining us. And for all our audience, thank you so much. Our next session is day after tomorrow. That's 8th May. We will be covering the latest treatment for enlarged prostate. So hope you all join us there. And thank you so much for joining us today.
Thank you. Thank you very much.